Hello, I'm Rodger Duckworth, a physiotherapist. Are you suffering recurrent injuries? Wondering why, even though you're getting therapy and intervention, it's just not going away or it keeps coming back? Or maybe it could be proprioception. I'm going to explain today what proprioception is, why it's important to you, and maybe why it's just perhaps the missing piece of the jigsaw as to why your problems just keep coming back. But before we dive in, are you new to my channel? Welcome. If you haven't already, please hit that subscribe button below and get the notifications. I'm going to be creating videos for you on a regular basis. Comment below because I want to know what it is you want to know. How can I help you? How can I explain things to you? What it is you'd like to know, and I'll do my best to create some videos for you in the future. Share this video if you like it. So proprioception, what is it? Well, let's break the word down. Proprio and ception. Proprio means position and ception means sense. So position, sense, awareness. Technically speaking, proprioception is awareness of static position. Kinesthetic awareness is the awareness of change of position and movement. But we'll call it proprioception to keep it simple. So what is it and why is it important? Well, if you're going to control anything in your life, you have to first of all be aware of it. If we aren't aware that we are getting angry, we can't choose to do anything about it and say, okay, I don't like that about myself, or I'm going to learn to spot the signals and do something about that because I don't like it and it's not pleasant for people around me. The same thing is true of our movement. If we're unaware of where we are in space, how can we control it? We can't. So I know where my hand is. I can move it around. I can do so with my eyes closed. I can put the other one in exactly the same position, mirror it. I wouldn't need to look at that. My body would know. And that is because I have proprioception. So how does it happen? Well, let's dive into a little bit of anatomy now, but I'll keep it really light. We have nerve endings all over our body in all sorts of tissues, in the ligaments, in the muscles, in the tendons, in the connective tissue. We have these all over the body, but particularly prevalent in the joints. They sense length, movement, change of tension in the structure, and they feed into our brain all the time, telling the brain about where our body is and how it's doing. It's a little bit like a robot. If you were going to control a robot that was going to go out and have an arm that would reach out, pick up a piece of glass, move it from one place to another, then you'd need sensors. Otherwise, the robot might just grip too hard, crush the glass, and that would never work. So you have pressure receptors on the end of the arm that would sense the pressure on the glass. Then that would feed information back to the computer that controls the robot and tell it that's enough pressure, stop now, right, we can now pick it up, we can move into the next part of the procedure, and so on. Well, our body's just the same, and proprioception is a really important part of how that happens, because that's the position, sense, and the sense organ that is that which tells us whether it's time to stop contracting the muscle, that's enough, the joint is in the right place, or not. So, why is this important to us? And why can this be important in preventing recurrent injuries? Well, let's take, for example, the sprained ankle. So, commonly we see somebody comes in and they've had maybe 3, 4, 5 episodes of a recurrent ankle sprain, and they come in and say, I've got weak ankles. And I think to myself, okay, I bet you haven't. I bet you have proprioceptively deficient ankles. And they look at me blankly. And then we explain this, which is why I'm doing this video, because I get asked it so many times. We go ahead, we undertake a proper examination, and I test their muscle strength. And sometimes they are weak, but more often than not, they are perfectly fine in muscle strength. But what they are lacking is positional sense awareness. We get them to stand on one leg, and they're fine. We stand on their problematic leg, and they wobble around, and they're not so able to control the movement and position. Get them to close their eyes, and it's even worse, and they're all over, nearly falling over the place. They're quite surprised at this normally. If we find out that they have a lack of proprioception, then this is a really big clue as to why they might be getting recurrent injuries. We can put them through a training program and a specific rehabilitation program to gradually restore their brain's connection down to these receptors. And the research shows that if we load the body, then our body will respond, and we will actually grow more nerve endings if the demand is placed on the body to do that. And so when we have that greater connection, when we have a greater awareness, going back right to where we started this talk, if we have a greater awareness of where we are in space, then the messages back down to the muscles to control the movement are significantly faster, more effective, an appropriate amount of force and time, and that means that we have better controlled movement. This is not just ankles. This can be any part of the body. It could be shoulder problems commonly, lower back problems even. I think it's a big missing part of why some people get manipulation, and we put the fire out, as I call it, which we're very good at doing in medicine, but people are not so good at then doing the next step. We put the fire out, stops hurting, get rid of the muscle spasm, get the joint moving. That's all well and good, and the patient's really happy. But the next part, to stop them having to keep coming back with problems and getting despondent and feeling like their back is weak, is have they restored this positional sense awareness? Are they aware of where their body is, and so can they control it with fine detail? So proprioception can be an important part of treatment and rehabilitation for almost any injury that you have. I hope this little video has been informative and useful to you. Perhaps if you or anybody else that you know and care about has a recurrent injury and a recurrent issue, and you wonder whether perhaps they might benefit from some intervention with restoring their proprioception, then share this video, let them know about it, and my contact details are in the website, which is down below in the comments box. So don't forget to comment below, click the subscribe button to get reminders of the next video, and put your comments down so I know what it is you want to know about. Let me know whether you like this video or if you don't. And I'll see you next time. Thanks for listening.